Hey guys, Dr. Brandon Schreiner here with Revive Chiropractic and Max Living. Today we're going to talk about hip mobility. Hey Dr. B, we're getting adjusted. We're doing all of our home rehab, but we're still having some hip pain when I'm running. We're still having some issues with the front, like we're chronic desk sitters, so we're constantly doing this. I'm having some pain kind of running around. And so we're going to give you some really quick and easy things that are not a replacement for your home rehab and your chiropractic, but are things for you to add on top of what you're already doing. Because what I said in the last video is that the body moves core to extremity. And so don't forget about your spine and making sure that your pelvis and your hips are in great alignment. So make sure that you're making your chiropractic adjustments. Make sure that you're doing your home rehab before you do these exercises. So the first thing that we're going to do is, this is what we call a foam roller, right? So this is more of an expensive foam roller that you could get, at Dick's Sporting Goods. And this is a little bit nicer, but this is also $50 to $60. Now, back here, you can go to Lowe's and you can get a $5 PVC pipe, but this is not nice, right? This is not supposed to be nice. This hurts, but it'll never break down and it'll save you quite a bit of money. So we're gonna take it easy on Jess today. Jess is my Vanna White, and we're gonna let her use this. So first thing we're gonna do is I'm gonna have Jess, let's say her right hip is we're gonna have Jess set her right butt cheek down on top. Okay, so what we're gonna do is she's gonna have her hands back behind her as a stabilization piece. And let's just say she's having some right hip issues. I'm gonna take this leg over top, and what she's gonna do is she's gonna bring her weight over top, and then she's gonna roll back and forth onto that. So that's what we call your piriformis. And your piriformis is a muscle that protects your glute. And so when you have a spine that's shifted or the pelvis is tilted, that piriformis will lock down and you get all kinds of knots and irritation. This is where you get sciatica. And so this exercise helps to kind of just wear on those knots. And so I always tell patients, when you find the spot that doesn't feel good, you can see it in their face, push and smush. And even like when you find that spot, like go side to side, right? To break up that tissue, right? Just like this. Now, she's gonna do 1 to 2 minutes as she's watching TV, as the kids are crawling on top of her, it doesn't matter, right? And then she's gonna go to the good side as well. So switch over and go to the good side. Don't just do the bad side, do the good side as well. Does that make sense? Cool. Now what we're gonna do is we're gonna do our IT bands. So sometimes like your IT bands go from here to here. Jess is a marathoner, so Jess runs a lot. And so these get super tight, but whenever these get tight, it pulls our knees in or pulls our knees out and affects our hips. So we're gonna have Jess go on her side. And what she's gonna do is she's going to, you notice how one leg is straight and this leg is like a pivot foot, and then she's on her elbow. Now what she's gonna do is she's gonna roll back and forth all the way up and down that IT band, right? And you can see here in her face, you'll see where it's tight. And where it's tight, I want Jess to stop, and then I want her to kind of take her foot through some ranges of motion here to break up that scar tissue through there. And then when that breaks up, keep moving her way down and doing the same thing. About 10 reps. Don't forget down here by your knees. So as we begin to kind of move into the knees, the same thing. Knees get irritated because your IT band inserts here and can create a lot of issues. So once again, 1 to 2 minutes each side, and don't just do the bad side, do the good side as well. And like I said, where do your hips and your knees insert? They insert on your pelvis. So make sure that you're staying hydrated, make sure you're taking your omega-3 fatty acid, make sure you're making your chiropractic adjustments and not missing out on your home rehab, because none of this works unless we get the spine stable and neutral. Until the next video, have a great day, guys.